Mental health diagnosis is not simply a formality for insurance companies or billing, but the reality is, if you don't have the right diagnosis, you don't know exactly what you're treating. And I will give a very good example of something that I see often in practice. This is not a distinction made in the DSM, this is just a clinical framework that I use. And the framework is a bit binary, but it is not supposed to be reductive. I like to think of primary depression and secondary depression. And I'm going to start with secondary depression. Somebody with OCD, ADHD, significant social anxiety is running into a lot of trouble with their day to day life due to their diagnosis. So the person with ADHD is chronically failing, chronically late at things. The person with OCD can't stop the intrusive thoughts, the obsessions, the very negative feelings. The person with social anxiety truly wants companionship but can't get themselves to interact with new people. What ends up happening a lot of times is people who struggle untreated with their underlying issue, they eventually get depressed. And their depression is a result of the dysfunction. Whereas in primary depression, what I'm terming primary depression is that depression is the driving factor in their dysfunction. Now, it's not that one is less than the other or one is less serious than the other. They're both very serious. But if you treat somebody's depression without fixing their ADHD that's causing their depression, you're giving them suboptimal treatment. You're not actually fixing the root cause of the depressive symptoms. And just to be clear, these distinctions are not very obvious a lot of times to the individual experiencing them or the clinician speaking to them, which is why it is, with the utmost importance to make sure you go through a thorough diagnostic process to make sure you know exactly what's going on so that we can head treatment in the right direction.